Hello, everyone, and welcome to the second session during National Black Researchers Week. Second day, a lot of things moving. We're excited to bring in our public health session. My name is Aika Luke, and I'm the Director of State and Community Engagement at the Association of State and Territorial Health Officials. And during this panel session, I will serve as your moderator. I am joined with our panelists. Well, I'll turn it over to themselves so they can introduce themselves, but really excited to be here and share space with them, and excited that you all are here to just listen in and have a conversation with us. And so the purpose of this session is really to have our panelists talk about their journey as Black researchers and to be in this space, just lessons learned, any resources that they'd like to share as they've navigated their journey, as they continue to navigate their journey. So I'll go ahead and dive right in, turn it over to our panelists to introduce themselves, and we'll jump into just some conversation and questions. So Dr. Frazier?
Sure, I'll go first. Hello, everyone. Good afternoon, good evening, depending on where you're joining us from. So I am Dr. Chantel Frazier. I am the CEO and founder of Anansi Research. It is a research company that I just started. I am in the public health space where applied research and policy research and advocacy really intersect is what my career has been made up of. And happy to tell you all a little bit more about what I'm doing these days and why. But I will launch into that later and let other folks introduce themselves.
Thank you, Dr. Frazier. Turning it over to Dr. Logan.
Hi, everyone. My name is Dr. Rachel Logan. I use she, her pronouns. I'm a health services researcher, mostly focused in sexual and reproductive health, particularly contraception, and right now also HIV/AIDS prevention. I do some work in birth and abortion as well. Those are areas that I am exploring a little bit more in my career. Currently, I'm a postdoc at the University of California, San Francisco in family and community medicine. And I also have an independent research consultancy. So I'm very happy to be with you all tonight.
Thank you so much, Dr. Logan. Dr. Sharon.
Hello, everyone. Thank you so much for this amazing opportunity to be here today and share space with you all. I am Dr. Sharon, and really I tend to introduce myself based on who I am before what I do. And really, identity-wise, I'm a Ghanaian American. I'm a wife and mom to 3 amazing kiddos, and that keeps me humble. I'm also the author of a children's book. I'm a poet. I bring all of my facets to my work. I'm very much blessed to be the principal of Tertia LLC, which allows me to bring out all these facets and where that research and evaluation had and work with some amazing folks. And then currently for the summer, I got to join the Texas Women's University faculty as an adjunct professor. So thankful for the students who were able to make it last minute and anybody else who was in my network and my amazing network who was able to show up here and support. And I'd just like to end that with all that work that I do. It's rooted, my vision for my work, it's rooted in culturally responsive and finding equitable ways of co-designing research and evaluation with communities. So happy to delve into more later. Thank you.
Thank you, Dr. Sharon. And so kind of connected to just a little bit of these bios and wanting to just invite our audience here as far as level setting and ensuring that we're all kind of talking about the same thing. How would you describe in your own words what public health research is? And feel free, whomever, to just kind of chime in and kind of what that means to you.
So I'm happy to go first. I would say that public health research to me is asking the right questions to focus on not just treating illness, but also preventing it in our communities, and doing that in a way that pays attention to resources, like who has them, who doesn't have them, are they equally distributed, how can we get them more equally or more equitably distributed in pursuit of better health for all. So not just treating illness, but also, investing in health.
I love that. And what I picked up on when you were sharing is really the notion around community, right? And to me, public health means. And I see this question from a very personal lens. When I was growing up, my grandmother raised me. When I was growing up, she referred to me, and it's funny, I didn't really get that grasp of that notion until way later in life, but she always referred to me as our Sharon. But it's her way of really rooting into me very early on about the importance of community. So with that, for me, public health research, if we want to do it truly from a population effort, is to ground ourselves in that notion of community. And it allows us to consider both the upstream factors, such as the policies you mentioned, Dr. Fraser, about just thinking about who has and who has not, our history, racism, and all of that in combination with the downstream factors, which is our behaviors and biology, all of that coming together and helping to really look at disease prevention and really thinking about our approaches from a transdisciplinary approach, right? And for me, when we do that, we come to the research from a sphere of more of a critical curiosity versus just thinking about standards as a way of approaching this. And we saw that a lot unfolding during the pandemic. So that's what true health research means to me.
My colleagues have done a great job of level setting. When I first thought of this question, it really was the study of life. I know we're not anthropologists, but every aspect of being born, living, dying, how we manage all those phases in between, how we engage with the physical environment and the socio-political context are all related to public health. And so, as others have said, it is a focus on community and the social and structural determinants of health throughout every transition and phase of life. And it definitely incorporates the environment, how we engage with the environment and how the environment engages with us.
Thank you, everyone, for just painting this sort of rich image and picture for us as we kind of see and illustrate this definition of public health research. And so I want to go back to how Dr. Fraser sort of started the question around asking the right questions. And so I think that kind of is connected to this journey that we're talking about with life. And for all three of you, how did you all navigate and even come to this journey in the areas that you all are sort of researching now, in the areas that are your passion areas and your focus areas? Describe this journey as being a Black researcher and how you started to ask the right questions and navigate and some of the just challenges and successes across that journey.
I can kick us off on this one. And there are about 4 main categories that might help me tell this story. And I'll start with my interests, right? And being able to pay attention to who you are, what really makes you tick. Because I started my journey off in the engineering sciences, nowhere near public health. But there was something about again, going back to community and me very much interested in how technology and the whole concept of engineering interface with health. So that started from the very beginning. So I went to school and got my bachelor's in biomedical engineering, actually minored in chemical engineering. And then I took that into my master's degree, did a master's in biomedical science and biotech. And all of these exploration allowed for me to ask some really critical questions at different seasons of my life. And one of those was when I was doing my work in, again, the STEM space, around and questioning, right, what I was seeing in our health system. And that's what really eventually drew me into public health. And then with that became the journey through my education, going back to school, learning public health, getting my MPH, focusing on health services research, and then finally getting my PhD in health policy. And then the other 2 things I like to hint on is about how all of those shaped my experiences to get me to where I am today, just speaking about that journey by itself, right? The experiences from those internships, those volunteer opportunities that practically paid nothing, but really poured into me and allowed for me to reach out and bridge that sense of the lack of network that I didn't have coming from the STEM field. And then finally, as with anything else, there are challenges, right? And being able to recognize that in life, when challenges come our way, recognizing that what we need to actually get through them is within us and around us. And my ability to really, and over time, it didn't come by magic, I promise you that, to really become more self-aware about that. And I think that really has helped me get to the phase that I am in my journey for sure.
Thanks, Dr. Sharon.
Well, after losing funding for a biochemistry summer fellowship, I was crying to a friend my junior year of college, just saying, like, I don't know what I want to do. I don't think biochemistry is for me. I wanted to be pre-med, but I had let that dream go sometime before this moment. And they started sharing about public health. I had never heard of the phrase public health before, didn't know what it was. But they shared this after I shared what my goals were. I just wanted to help people. I wanted to understand health issues, even talking about my community and my family. And after doing some research and realizing like, oh, public health is interesting, I applied for an MPH program, started the following fall, and kind of took off with public health after that. Just sitting in my first graduate public health course, it just felt like I made the right decision. But it wasn't until much later. So it's funny because you get a certain level of education and you feel like you know a lot. And then I got more education and now I realize how little I know, having a PhD now in public health. But a lot of the education and training really centered the work of white researchers, white theories, methodologies that didn't incorporate structural frameworks, talk about racism, those kinds of things. And so now I'm still in the process of learning, even after getting a doctorate, about new ways of doing the work that I want to do. So anti-racist, equity-oriented, reproductive justice-centered, person-centered health services research. Those were aspects that did not or were not featured in my formal education and training at predominantly white institutions. And I also, at those institutions, didn't have a lot of Black faculty or people of color, or even researchers who were really committed to understanding structural racism and dismantling it through epidemiology, social science research, and different kinds of methods that we learn about. So there have been a lot of points of growth and also a lot of points of vulnerability along my journey that we can definitely talk about further.
Mm-hmm. Yeah, so similar to my colleagues on the panel, I did not start off in public health. The original plan was to be a veterinarian. So I started off in step 2. I was a biology major. And I, throughout my college experience, found sociology and found medical sociology and started learning about all of the things that your biology that shape your health and your health outcomes, like what kind of neighborhood you live in and whether or not you even have access to a doctor, or do you feel safe going to see the doctor for preventative measures, cultural factors, all of that. So sociology and I found each other and it was this perfect mix. So I declared sociology as a major and stayed an extra year and did all of that. Went to graduate school on the support and guidance of 2 of my professors in undergrad who really sort of took me under their wing. And for one, I was doing community needs assessment work, which was amazing. And I had always sort of been research oriented, like even in my previous thoughts about my career, I really wanted to be doing something in research. But in medical sociology, there was just so much you could do. And it was so interesting in so many different ways you could go. And also the sort of rich tradition of Black sociologists like W.B. Du Bois and other folks who are really just sort of integrated into the curriculum in a way that's really powerful. So after all of that and during grad school, actually worked full-time in grad school too. So I took a little longer to finish my doctorate, but it was also really valuable and interesting because I was able to work on the applied research and policy side while I was doing my dissertation, which definitely influenced sort of the frameworks I used coming at things and what I wanted to do after graduation. So then moved to DC and did some consulting work, some advocacy work, was on the Hill, and did all of that really interesting stuff. And finally came to a point where, I wanted to do something more mission oriented and direct. And I had been working in mental and behavioral health. So that's why I started my company. So I focus on where policy and research and storytelling come together in the interest of better mental health for Black communities and other communities of color. So I'm really, really excited to be doing this because I believe that research has the power to change the world and change everything if you do it right and you bring the right people to the table. And so that's how I got to where I am. In terms of challenges and successes, I was thinking about this a little bit earlier today. And actually, the challenges I've had, which I think will ring true for a lot of folks in the public health field, is just that there's so much going on and there's so many options, and it'll really be up to you a lot to direct your own ship and narrow it down to what you want to do and what you want to be good at and where you want to go. Because honestly, there's a lot of work to be done and we need all of us, but we need all of us to be really, really on our game because there's a lot of work to be done. So it'll really be up to you to focus in and take advantage of all the opportunities and the potential mentors and potential paths you can take. Because my, challenges have been like, okay, if I choose X, then I'm not choosing Y, and you have to commit to one to get good at it. And my successes have been, that's gone pretty well for me so far. So everything has worked out and I've learned a lot and got a lot of great experience in different areas. But I think that'll be something that especially the folks who are currently in grad school and like looking ahead should be aware of.
That's great. Thank you all so much. So many gems. And this thread that I feel like I'm hearing from all of you is this commitment to curiosity and this commitment to being a lifelong learner. And so, I really want that to kind of sit with the audience and the attendees in this room of how you all have navigated this constant and consistent journey of learning, unlearning, navigating, being curious, asking the right questions, pivoting, most importantly, and creating that space to allow that growth to happen. And so, in an ideal world, right? If you had a magic wand and you could go back, what would you tell yourself as, starting out in public health research? If you could do it all over again, what are some of the things that you would change, if there are any? And what advice would you just have for, people in this space who are probably at varying levels of getting into public health research? What advice would you have for people interested in public health research? Remember,
So,
you have a magic wand, so dream
yeah.
big.
Yeah, and along with that, right, I would say think big. So think about the things that you want and you are most passionate about and what drives you. And also think big in terms of your research, right? So what's the big goal or the big endpoint at the end of this? What will you want to have accomplished? And how do the little details and things sort of link to that and come into play? Because full disclosure, I had to do not my dissertation, but my dissertation proposal I had to do twice because I was thinking sort of granularly, like, oh, here are the things I want to study. Here are the, sort of variables I want. But I hadn't thought about the big picture of, what's actually out there, what's actually available. I tried to get a data set that I didn't actually have access to, and it would have been like a huge institutional thing. So I had to sort of scrap my initial project and go with a new one based on the things things that I actually could study. But thinking in terms of, what do you want to have your first publication be? Because that's going to be your dissertation. If you do a PhD, that's going to be the first piece of work tied to you and your name and your career. And where can this propel you to, right? Where do you want to go? So I would think big and don't be afraid to. Like one of my panelists said already, everything you have to succeed, you already have it inside of you. It's already available to you. If you don't know it, you can learn it. If you can't learn it, you can hire for it. Like resources are available. So don't be afraid to think big.
I definitely think one piece of advice, which may not exactly be related to research, is if I could have a magic wand and have a do-over, I would not go into debt for my degree. So at the master's level, that was something that I definitely would ask people to reconsider and think about. I have a friend who had an employer pay for that and is now doing, work for a state health department and other entities doing research, but maybe took a little bit longer, or paying for courses and some of the research skills that you might need and can maybe supplement through work. So be creative. So I guess with thinking big, also be creative. I was one of the most educated people in my family. My family was like, oh, you're going to get a master's degree? Awesome, great. No one else has that, so sure. And then on the other side of that, I see that it does limit other opportunities when I was coming out. So you're restricted as to where you need to work in order to pay back all the debt you accrued. So I think that's important. And then as far as research, I would say what helped me in my doctorate was relying on peers. Oftentimes we think of trying to find the most senior researcher, the expert, the one that has all of the grant funding, all of the accolades. But oftentimes those are people who don't always have the capacity to take on and mentor more people, especially if they're a Black or Brown scholar. They're probably beyond capacity at that point. Mm-hmm. So using peers, we found a data set, we just started doing secondary data analysis, and each one of us got first authored papers from that, having other faculty mentors supervise that and provide guidance. Also using your courses, if you are in a formal education system, using every single course to say, like, I'm interested in X. When I take my qualitative methods course, I'm going to still think about X. When I take my quantitative methods course, I'm still going to think about X. And through your coursework, you get to build your own compendium of information related to something that actually interests you, as opposed to every class you're now thinking differently about a new topic. Try to hone in on some things so that you can have some commonality. And you might even hear this from statisticians who are like, I save all of my code. I keep refining this thing, as opposed to let me cast a wide net, and one day I'm doing environmental health, and the next day I'm doing cancer research, and the next day I'm doing HIV. So think big, but be very strategic about where you spend your time and effort. And lastly, if you aren't tied to a formal education system, or if you're going to be exiting a program soon, any opportunity to do research is experience. And so don't worry so much about, again, working with the most credentialed person, the best lab, the most rigorous, whatever. Try to find some small projects that you can get some experience on. So my first exposure to research was in undergrad, working with a psychology professor, where I got paid like pennies to go downtown, talk to drunk students, and do alcohol-related research. And at the time, it was like, oh, this is nothing. It's just to, get a little money. But once I started applying for other research positions, I had that in my back pocket of I actually know about an institutional review board. I know about human subjects research and ethics. I know about quantitative data analysis. I started using different data analytic tools, even at that stage. It felt like not a lot, because of course there are people who are more educated than me, but it was something. So I say, get started.
Such great gems. Even I am taking notes here. Thank you both. And I'll just add three more things to all of that. And the first is, if I was to go back, I would just tell myself to embrace the journey, right? Because I started off when I was starting my career way back in during undergrad, and consequently all the way through my graduate school career, was really narrowly thinking about my journey as being too linear, or thinking about it linearly. So if I were to go back, or any advice I would have if I had that magic wand, is to just embrace the journey for what it is. It's never linear. I've accepted that, and never have I encountered anybody that I've been fortunate to have their story told to me, and have they had the story in any linear fashion. So just be mindful of the fact that the journey is not linear in any fashion. Also remember to ground yourself in your own self-care well-being. We take that for granted and we lose sight of that very easily. You can't give what you don't have. So always remember who you are and how to take care of yourself in the process or in the midst of it all. And that's one thing I would have loved to be very well imprinted in my brain if I were to go back and redo this. And then finally, don't be afraid to be the lone voice. We've been told to think big, and think big also has this notion of courage to it, in my perspective. In some situations, you will be the lone voice, but be that lone voice in service to equity and justice, right? Especially as we grounded our session from the very beginning about community. And if we really truly are doing public health and research in service to community, we can't do it without that lens of equity and justice. And truly, the way to start disrupting these systems that have been plagued with all these dominant narratives, right? Fed with the concept of whiteness that birth colonialism, racism, all of those narratives can only be broken down by us lifting through dialogue our voices, making space for voices that are not typically heard, and allow those voices typically being pushed to the margins continuously, historically, having and making space for those voices and being that lone voice to bring and highlight those voices is one of the things that I'll use my magic wand for.
Thank you all. I received that and kind of sit with it and think about just being intentional and being strategic, and but also that space and grace, and kind of reminding that you can't pour from an empty cup. So you also have to recharge your batteries throughout that journey as well. I want to revisit a couple of comments that I heard around just mentorship. And so I think in, Dr. Frazier, you talked about having to redo your, dissertation proposal. I know Dr. Logan, you talked a little bit around just networking and that balance of where your peers are also, colleagues, can be people that you're into being intentional with connecting as well. Can you all talk a little bit about, and just providing some thoughts for the folks in the audience, who you think would be great people to network with, your navigation through networking and building those relationships throughout your careers as well. Because I think that that mentorship piece, but also building your network of colleagues who you can also share space with, is really important to touch on.
Well, I think it goes back to what I initially said, and Aika, you mentioned it as well, of like leveraging your peer group, because it wasn't until someone kind of broke it down to me that the people that are around the same level as you are going to be the people who enter into your discipline at the same time as you, who will also be the people who, if you're, say, in an academic institution, will be the people who look over your grants, review your papers, do all of the things. So yes, it's senior people that you should know and network with. And I did that mostly through going to conferences, attending people's sessions, walking up to folks saying, hi, my name is Rachel Logan. I'm a student right now, or I'm doing this thing. Being friendly and open to folks, because you don't know who's right beside you. And then again, leveraging your peer group and also your family and friends. I think we sometimes exclude them because they may not have the same credentials, but you would be surprised how somebody knows somebody that knows somebody, and you wind up having, entrance into an interview process or being able to do an informational interview with someone. So I understand that it's not about leveraging people and like extracting from them in that sense. It really is about bringing your authentic self, knowing what you want, and being able to communicate that effectively. And oftentimes, if you can really communicate who you are, what you're about, and what you're interested in, like as far as opportunities and things like that, oftentimes people will really try to help you out. That has been my experience. It may not be everyone's, but if folks know, like, oh, I heard you're looking for a job, or you're about to graduate, aren't you? And they're looking out for you, but you have to communicate. You have to be open and be able to articulate those kinds of things. And then always, always giving back and doing it at any stage. And I was surprised by my own reluctance to start to mentor, talk to younger folks, but it felt like I'm not experienced enough. What can I say as a master's student? What can I say as a doctoral student? And you'll be surprised that folks really just need to hear from someone who knows about their experience, that looks like them. And again, those will one day be your colleagues. So it's good to start paying it back, or paying it forward now.
Yeah, so I would say this is where you get to be strategic. And if you are a person who enjoys tables and charts and lists and Excel, then this is where you really, really get to use all those things and sort of organize your network. Because first, your network should definitely be diverse. As Rachel just said, who knows somebody who can be helpful to you, or who will be supportive to you, or will just be, a listening ear or a friend. So definitely have a diverse network of people. They don't all have to be researchers or even in research or even understand what you do. But there are a lot of people who are in like PR and communications who can be really helpful to you if you're trying to get your really innovative or amazing research covered by the news or something, or you write an article and you want it to be covered, and someone who does social media for their job. They can give you some tips on getting your name out there, on getting on a panel like this. Your varied network will help you. So the more kinds of people, the more people in different kinds of fields, will just open up the world and open up options to you. Knowing people in policy and people who work on the Hill, it's a very different experience from knowing people who work in government and work for like the CDC. So make sure that, you know people who are doing lots of different kinds of things, especially if you aren't totally sure on what you want to be doing yet. Those informational interviews with people like that, or just like grabbing coffee, will be very, very beneficial to you. And then I'll also repeat some knowledge, some wisdom that I've heard before and have always found to be true. And that you should create a network of people who are in front of you or ahead of you, who have like these established careers, people who are on your level, the peer level, who are doing around the same number of years as you, and then people who are behind you, right? So that you know what's going on, about new innovations or what's coming up next or new things in research. But also so that you can be helpful to those people, because sometimes you learn the most and the best from, delivering something to someone else. So that's what I would focus on.
Thanks for sharing that, Dr. Frazier, because it made me think of something I learned too, and I'm going to try to remember it in terms of how to think about your network strategically, operationally, and as part of your development, right? And strategically is exactly that. How do you know? And typically your peers, in this case, will be very good for that, because you want people to tell you the truth. And so being strategic about making sure that people that surround your circle are folks that you've given permission to speak truth into you. Professional, developmentally, so obviously looking ahead, right? Where do I want to see myself? Who has done that I can lean into, who is willing and available, right? And that's where, and I think Dr. Frazier said it too, this opportunity, joining, associations like ABR, it gives you that expansive network to be able to tap into different resources and experts. And then finally, I think the operational one is the one I haven't covered. So just in your day-to-day, trying to get things done, who is that network that sort of helps you? It could be your colleagues at work, or just folks that have similar interests in your field that you can tap into. So thanks for sharing that, because it made me think about that.
Yeah.
May I add one other thing? Because I know LinkedIn and social media are becoming really big. Some advice that I think has been very useful to just share in this forum is with contacting strangers, folks that you don't have connections to, be very clear as to who you are, why you're contacting them, and what you want from them, and don't ask for too much. And I say that as a person who's a Black woman who random people sometimes email me or contact me to pick my brain or to extract just information and resources. A 15-minute chat with a stranger, I'm willing to do if it's clear that you know what you're asking. I have declined to talk to people who it's like, hey, you're in public health. Want to hop on a call? No, I don't have time to hop on a call to just talk about public health. Is there a particular question that you have? Is there something that you want from me with this time, as I'm very busy as everyone else is too? And then doing your research. I have a mentor who's well known in the field who often declines to talk to people who ask very basic questions about her work that demonstrates that they have done no research. They have not looked into or read any of her papers, looked at any of her commentaries, op-eds, media appearances, and yet they want time from people. And so I get that folks may be offended by that and just say, well, you're a public scientist, you should be able to hop on a call and answer questions whenever I ask. But that's not how this works. Be respectful of people's time. We're talking about self-care. We're also talking about boundary setting. All those things are important. So if you want something from someone, if you want to use or leverage their knowledge and connections, oftentimes people are willing to provide that if you're very clear about the why and it makes sense.
Yeah, I highly echo that. Don't ever say pick your brain. That would just shut the door.
It's funny because I'm listening and you all are making a lot of thoughts kind of run through my mind, and I appreciate the honesty and the transparency in this space, and allowing sort of everyone to kind of hear the balance between how you all have navigated networking with some of that advice that you have as they navigate networking with others too. And so I think, Dr. Sharon, it was you who brought up the word operationalize, which to me hit a light bulb around, sometimes people are like, okay, in these spaces, we're talking a lot about the theoretical, where are some of the practical applications or approaches and things that people can operationalize to actually put this into practice. And so a question kind of that comes with that is, when we think around just resources and skills, in your experience, what are some of the resources that you think future or current researchers should sort of tap into, as well as skills that they should try to add to their toolbox as they navigate their public health journey to become a researcher?
I'll say two things, and I'll open the floor. Because when I was reflecting on this question, it was a bit difficult because there's so much out there. So my answer might be very broad, and I don't know whether it would be helpful. However, I wanted to pick up on what you said about the three things about to create your network. And actually that in itself is a resource. So sitting yourself down and thinking and looking around you and saying, okay, whom in my network could I tap into and start building? Because it's a relationship building thing. It's not you're a mentor and I only come to you when I need you. No, you build that relationship over time. So doing that homework, as we've been told, and creating that list. Who in my network would I like to build that relationship with for strategic purposes? Whom would I like to network with and help me in my operational, in terms of the public health field, or whatever interests that you have when it comes to research? Whom should I start building those relationships with? And then the last one is the developmental piece, and then looking ahead and saying and telling or asking questions about yourself. Where do I see myself? Do that short-term, 3-year, however time frame you're giving yourself for that, long-term, and create those resources for yourself. And I think once you sort of have, I always think of from the people side first. Once you sort of have that, then for me, it's easier to tap into their work. It's easier to then, when you look into their work, what else has perhaps been published about their work, and also lets you into understand the different avenues, right? So if I were to pick ABR, for example, and if my interest is in your work, Dr. Logan, and I have that and I start building that relationship with you, who knows, then I get exposed to the mentor that you mentioned who has more years of experience. Then I have that work or the person's work and actually perhaps her time as a resource. So I like to think about it from the people aspect first.
So I will follow on that. There are so many good resources. It's a little bit hard to choose and to recommend which one. But I would say along that thread, we are the resources. And I mean, like we, your community. There are so many new Black owned businesses that are focusing in on like Black folks in data science, Black people in analytics. There is qualitative research groups that are out there. So it really depends on what you want to do. So I would say, find your tribe, find your people, type in, what you're interested in, plus conference, plus Google, plus your location into Google, and you would be surprised by what comes up and who is out there talking about the things that you want to be talking about, or specializing in the things that you want to learn. So I would say be very targeted, and definitely reach out to people and use them as resources appropriately, right? Like send them messages with exactly what you're interested in, do your research before reaching out to them. All of that, be, polite and good humans. But also don't be afraid to reach out to people, because the majority of people will want to help you and are excited about you. I can't tell you how happy I am when like fresh grad students come to me and are like, oh, I'm so excited about reproductive health and I want to talk about your dissertation that I haven't thought about in like 10 years, but I would be happy to talk to you about that. And I'm glad you're excited, and, just happy to have more people on the public health team. So, we want you to do well. We want you to succeed. Most people want you to succeed. So don't be afraid to reach out to people, but make it easy for them to help them help you by being really, really targeted and strategic.
I mean, all great pieces. And a couple I would like to highlight here, and this might seem overly basic or simplistic, but I think access to reading material. So whether that is literature, if you can still maintain access to those things, that is a key resource. I think or not we, but sometimes folks may discount the need to read and write to improve your research. I don't think you can become a good researcher unless you're reading and writing what's out there, connecting thoughts and ideas, putting words on pages. Oftentimes we really focus in on either quantitative analysis, qualitative analysis, but the real way that you become a researcher is disseminating ideas. And so reading as much as you can, and not only literature. So I had a friend who we started a summer reading group with some Black or Afrofuturism literature. And we started thinking about sociopolitical theories and structural frameworks and incorporating and blending things. So expose yourself to a lot of different things with the idea that you want to connect thoughts and ideas as much as possible. And reading is one way that helps us with our imagination, with our creativity, which science is a creative practice. And writing helps us articulate those things. And that's how you get more pubs. That's how you get the grant dollars. That's how you advance your career, or just share ideas. It could be on your blog. It could be you have a fire Twitter thread. It could be multiple things, but getting your thoughts out there in the world and having the feedback loops, those are all resources that help hone your craft. And I'm saying that as a person who's definitely a millennial, and this is just a different way that we're engaging with science than previous generations have done before.
These are all so good. I mean, sometimes I feel like you just have to sit there and pause for a second to digest and kind of take these gems with you. And so I want to lift up some of the questions that are coming through via the Q&A, and please, attendees, continue to submit questions. as I'll continue to lift them up to our panelists in this space. And so one of the questions is centered around specifically studying racial inequities and health equity. And so wanting to just invite for the panelists who are doing research particularly targeted in that area, how has that navigation been to just try to collaborate with other sectors, try to collaborate with other people who are doing work in that space? And what advice do you have for researchers who are interested in studying the vast racial inequities and social determinants that exist?
So I have a few thoughts and might answer the question in a bit of a cyclical way, if that's okay, just because that's how the thoughts are coming for me. So first of all, be grounded in why I want to do this work. Just because, I mean, ancestors have been studying this and ringing those bells about this work for generations, right? They almost fell on deaf ears. And now all of a sudden we're slowed down by a pandemic, and we had a murder of an individual, George Floyd, I'll name him. And then all of a sudden it's like everybody from the woodworks is coming out, let's do health equity research, right? So basically with that, first of all, be grounded and know the reason why you as an individual want to do this work. So that's where I'll start. And then secondly, like I said, there's tons out there. This is nothing new. It's been studied and we talked about for years and years. So do your research. And then once you have an understanding and know how your work might help move the field forward, we've already said it, there's us, right? The network is available. Reach out to folks. Once you're reading those articles, you have authors' names, they have ways of contacting, just reach out. If it's a cold email, you never know. Someone might, I tend to reply to those emails when I get them from my publication. So I could be that person that reaches out. And then thirdly, recognizing that it depends on how you structurally, in terms of your career, where you sit, there might be some challenges versus not. I am fortunate enough that I have an outlet with my consulting firm that if there's structural barriers in my 9 to 5, I can lean into my consulting firm to be able to have that flexibility. So also knowing the constraints environmentally, professionally, whatever that means, that you have to navigate to be able to do that work is also critical.
So I would say, I will re-emphasize do your research and lean into the people who have been doing this for years and years and years. Because I remember learning about social determinants of health, the first sociology course I took, and it was, it definitely was ignored and discounted and was, not paid attention to for years and years and years. And it's nice that people are talking about social determinants of health now, and it's really important work. But I think that the people who have been doing this for the longest know the most about it and are the authorities and are the sort of authentic people who are doing the work for the right reasons and the folks you want to be working with, versus other people who are sort of swooping in and companies that are swooping in and saying, oh, this is suddenly important to us now. That's not where you want to be. You don't want to be working for and with those folks who are just, changing all the words on the website to say equity now, as opposed to like actually doing the work and being invested in it for the right reasons. So I will say, definitely do your research and reach out to the right people, and read the things that they've written and produced. You will know it is very clear who actually understands this stuff and is invested in it. So I would say, just steer your car in that direction and just be aware. Because hopefully this continues to go on and we stay focused on the right things and fund them and support them, and create structures to support and uplift people. But, it is also a bandwagon right now, unfortunately, and not for the right reasons.
Sure, Logan, I don't know if you have anything you'd like to add. Great. Thank you both for those responses. And kind of, I think a balance of you talked a little bit about your work in consulting and doing some of that work from the side. So can you speak a little bit about just public health work, research, and how you all have navigated your journeys into consulting, and how you have sort of find that good intersection for your entry point from your experiences?
Well, I was essentially forced into consulting as I graduated with my doctorate December 2019 and was waiting to hear about a job. And then the pandemic hit and it was delayed. And I have been working with a researcher or in preparing for getting this grant funding that would fund a job. And so they hired me as a consultant. And once I got confirmation from the funder that they would not be funding that program until all money was spent on COVID-19 research, I formalized it and said, well, I'm going to have a business then, and started reaching out again to my network. I was just telling a few people like, hey, I'm consulting now. Like, let me know if you have some work. And for the most part, researchers have endless amounts of data. If you've worked with folks at academic institutions, at least, I'm not sure about other places, but they often have concurrent research studies, multiple studies going on at the same time. An nth of that data often gets analyzed. So folks had a lot of data that they were sitting on, had questions that they wanted to answer, but needed someone to do it. So I was hired and I still do some of that work now. I mostly work with academics. So my ability to still engage in human subjects research comes through their institution's IRB and ethics approval oftentimes. I still am publishing, doing all those things. I mean, I am a postdoc now, but there was about a year and a half, 2 years where I was not formally affiliated with an academic institution and was still publishing and doing those things through my consulting work. Advice that I have received from other more sage consulting researchers is, protect your intellectual property, have contracts, have everything in writing. I right now am mentoring a former student who I advised through their undergrad and their master's program, who's now fully graduated with an MPH, about starting consulting. They're working at a job that pays okay, but oftentimes early MPHs aren't really getting paid maybe what they want to get paid. And I said, maybe you still work there and you supplement that income through consulting. They also are a bit hampered because they work for an agency which has some control over what they can say and do on the job. So again, as Dr. Sharon said, consulting helps them really do the health equity, health-oriented research that they really want to do, or programs and services that they're interested in when their job doesn't allow for that.
Thank you, Dr. Logan. Yeah, I saw Dr. Sharon, I saw you come off mute too.
Yes, and I'll probably do two things. I'll answer the question, and also because I was going to name this person anyway, and I just saw that he had a question. One of my mentors, Dr. Delgado, is in the house. Hello, and I saw he had a question in there, so I'll probably tackle both just because of the interest of time. So part of my approach is building those relationships. In my case, I've always been an entrepreneur, so both my husband and myself. So we formed a business way before an LLC, way before we actually had business coming in. So in terms of affiliation, it was something that we can always tap into when the opportunities arose. So when I made the switch into public health, and I ended up doing my dissertation work from a more primary data collection piece, and again, going back to those relationships, keeping that relationship with the group that I was working with, I was able to then build that out into my consulting practice, where it was working with the group, it was publishing under the consulting umbrella. So it's, again, back to the intellectual property, it was ways for which when you see my publication, you see my business associated with it. So it's not my 9 to 5, for example. And folks like Dr. Delgado have really been instrumental in me, from a research perspective, being able to think about ways that I would like to run the business from a research perspective. Like I mentioned earlier, I also wear the evaluation hat, and I'll be honest, most of the work for my in terms of the early stages anyway, was more in the evaluation sphere. And again, building those networks and collaborating with other colleagues who are in the evaluation space to go after work together. Now, to digress a little bit to answer the question from Dr. Delgado in the chat, and it really aligns with my answer with this question, is if I were to go back and give an advice to a student that wants to be mentored by myself, thinking back to what I got poured into me, what I'll add to the advice I got was to also think about the four walls of the academic institution. And for me, I always knew that the sort of work that happens in academic institutions are great. However, there's more out that I wanted to tap into and use that as a way to also contribute to academic institutions, which is why the adjunct role works well for me, because I can pull into that experiential pieces in my teaching, but not also have to deal with the policies that tend to happen in academic institutions. So I don't have the patience for that. So basically, to answer the question, is always think about the thing beyond the four walls of the academic institution.
Mm-hmm. So I would say the consulting world has a lot of things to offer and is actually a really interesting sort of playground for researchers. You know, you can get work done that's published. You can work with people who are interested in publishing. You can work with people who are really interested in doing presentations. You can work with government agencies and local, like county offices and state and federal departments of health. You can do all of that. So I would just say, you know, in the consulting world, it's again that sort of embarrassment of riches, right? Like you really have to decide where you want to go and what you want to be doing. And if you are in a position where, you know, you go and work for a consulting firm and they do all sorts of stuff, then be really strategic about who you work with and what you work on, and make sure that you're getting all of those well-rounded opportunities to have your hands in as many experiences as possible, so that you're setting yourself up for success. If you do want to start a consulting firm or do something like that later, then, you know, you've done state work, you've done philanthropic work, you've done qualitative work, you've also done quantitative or surveys or something like that. So just make sure that, you know, you're lining up the opportunities to best situate yourself for your future and based on what you want to be doing, and also the things that you could want to be doing, right? Like make sure that you're invested in being well-rounded and having those experiences, because, you know, no one else is going to be as interested or invested in your career, and maybe no one else should be, right? Like you get to be really excited about the things that you want to do. So make sure that if you have those opportunities that you jump at them.
Thanks everyone for that. I know we're getting close to time, so I want to point to everyone's attention to the chat. Leonore posted in the chat ways to connect with myself as well as the panelists. And I know Dr. Logan and Dr. Sharon also dropped their information in the chat as well. So feel free to connect and reach out to all of us to sort of continue this space and kind of conversation. And so as we sort of close out, I'd love to invite the panelists to just drop just one takeaway that you want attendees to kind of walk away with from this sort of rich, interesting, gem-filled conversation.
I would say, just really to reiterate what has already been said, I think Dr. Sharon started us off with everything that you need, you already have. I think the process that many of us need to go through is peeling back the multiple layers, the indoctrination, all of the things that block us from reaching our greatest potential and already feeling like we are enough. I think many of us are still seeking something external, more education, a new program, a new fellowship. If I just get this additional thing, like I will be fine, I'll be set. And that is really not the way to engage in the research that you probably really want to do. It's really recognizing that you're enough, you have what you need. It's within you and your community, and just go off and be excellent, dreaming big and being strategic.
Couldn't have said it any better. And the only thing I'll add is, again, based on that, just start with what you have. think about it from an asset-based approach. We're never lacking. There's always something that we have to start there.
I'll echo all of that. I will, say the things that if you were lucky enough to have parents who said this to you, you can do anything that you want. You can do anything you want to do. So just figure out what you want to do and figure out what you need to get there, and then go out there and seek out the things that you need to get there, whether that's more contacts in your network, more skills. You probably don't need more skills. I agree with Dr. Logan. We often underestimate how good we are at things and how many skills we have. But, and then reach out to us. I was not able to drop my info in the chat, but Chantel Frazier, you can search me on LinkedIn, you can reach out, or you can email me, cfrazier at Anansi Research, Anansi like the spider. And, anytime you need anything, reach out. I may regret this later, but that's fine. Reach out, ask me questions. I'm here to help.
Perfect. Thank you, Dr. Frazier, Dr. Logan, and Dr. Sharon for joining us today and sharing space and providing just information on your journey and supporting all of us through our journeys as researchers and future researchers. I will turn it over, and I also want to thank the participants and attendees for kind of joining us in this space as well, and taking time out to kind of just listen to us chat and share some gems with all of you. So I'll turn it over to Leonora to